We are staying with the fuel tanker disaster that claimed more than 100 lives in Jigawa State on Tuesday. The medical teams at the Federal Medical Center in Nguru and Federal Medical Center Birnin Kudu say they are working around the clock to stabilize the affected persons in their facilities. The Deputy Head of Clinical Services at FMC Nguru, Dr. Akinwomi Ademola, while speaking to Tvcnews reporter, revealed that the health conditions of some victims have continued to deteriorate, with over 70% of their bodies severely burned, and more than 70 victims are currently receiving intensive care at the facility. He explains that despite the challenges, medical teams remain committed to reviving the victims and that the hospital has mobilized additional resources to cope with the influx of patients. Governor Umar Namadi, who visited, said the state government will deploy extra staff and equipment to ensure each patient receives adequate attention. In the meantime, the Inspector General of Police, Kayode Egbetokun, has sympathized with Jigawa state government and families of victims over the incident that occurred at Tara local government area. The IGP, in a statement by the force spokesman, Olumoyiwa Adejobi, commends the effort of the police personnel and other emergency responders for their swift action in extinguishing the fire, evacuating the victims, and ensuring normalcy is swiftly restored in the area. While praying for the souls of the departed ones, the IGP reassures the general public of robust sensitization programs on the hazardous effects of oil scooping and other similar activities to avoid recurrence of such incident. Tvcnews senior reporter Ibrahim Issa, who has been monitoring the development, joins me now on the news. Ibrahim, bring us up to speed on the condition of victims of this tanker explosion.
Well, I must say currently I am at Akinwomi Ademola Teaching Hospital, AKTH, right here in Kano, and behind me is Magad Kambata Bones Ward, where about 16 patients brought from Saura are currently receiving medical care. We earlier spoke with the CMD of this hospital, and he told us that about 32 of those victims are currently admitted in this hospital and are currently responding to treatment. And a few moments ago, we were at the ward, and we had the opportunity to speak to about 2 or 3 of them, and they narrated their audio, but of course called on the government and philanthropists to wade in and provide more resources for medical care. Initially, the Akinwomi Ademola Hospital told us that they have footed the bills of those 32 patients, which will last for about 48 hours according to the rules, after which the government or philanthropists or whoever is interested to wade in and provide more resources for their quick recovery. We learned that treating burns patient is very expensive, and it takes about 3 months minimum and at least a year in some cases for one to recover fully. So these patients are calling on the government to immediately wade in and provide the necessary support for them to recover fully. But as we speak, they are currently responding to treatments.
All right. And indeed, since the incident, the death toll has actually been rising. But what have we gathered about, from people around that vicinity on their reaction to that and their level of consciousness and self-awareness to preventing recurrence of an incident of this nature?
Yes, we spoke to some of them. You can see some of them are currently seated close to the ward where the patients are currently admitted. And they told us that authorities should, as a matter of urgency, ensure that whenever such incidences occur, presence of security operatives is very important to make sure that people don't go closer to any of, to avoid future occurrences. And there have been commendations from these families of the victims as regards the effort of the government to move this victims from different locations to different medical facilities to receive treatment. So these families say that the security operatives should as well help in ensuring that no one goes near such incidents to avoid the number of those that are affected. I learned that about 153 lost their lives, and we learned that those 32 that are currently admitted at this AKTH facility are all alive, and none has lost his life as they are currently responding to this.
All right, Ibrahim, we thank you very much for this update, and we look forward to what the reaction of government would be to the call by these victims to be supported, because with 70% of their bodies severely burned, it may look like a long road to full recovery. Thank you, Ibrahim Issa, for the update.